Okay, now, yeah, got it. Okay. It's going, it's live. Yeah, it's live. Okay, so hi everyone again. This is the second healthcare meeting, and Adam today can join us. Hi, Adam.
Hello.
How are you?
Doing well. I'm excited
Okay.
to see what we have to talk about today.
Okay, so he promised me we don't have surprise today, so I believe it. uh,
Not today.
oh, okay. So guys, today I prepare uh, how healthcare can work at e-NABLE. It's another discussion. I think it's important to this group and to healthcare and makers. I will reinforce that every meeting because it's not just a healthcare meeting for healthcare people. It's just for makers too. So how healthcare can work at e-NABLE? This is a question for everyone. It's not for healthcare. Like I told you before, it's for everyone because if you have the prosthesis, you have the 3D printer, how healthcare can work at e-NABLE. So I think it's important first, let me just take Adam out from here. So, it's important to first mention that there are two types of amputation. Those acquired during the, I have difficulty to say this word, course of life, which are caused by accidents at work, involving machines, traffic accidents, injuries from domestic violence, as well as those that can occur due to bone tumors or serious infections, and congenital amputations, which occur during embryonic formation. For this reason, it's important to emphasize that no limb amputation will be identical to another. Consequently, every prostheticization process will vary from person to person. Again, I have to remember you, I'm from Brazil, so I have to read the English to speak well. So sorry for reading the slides.
No, you're doing great.
No, it's because it's frustrating because I'm so better in Portuguese.
Oh, for sure.
Yeah. So it's just to remember people about that. Uh, so prostheticization process, the prostheticization of amputates involves an interdisciplinary team that includes doctors, physiotherapists like Adam, occupational therapists like me, prosthetists, and other health professionals. Each professional will play a crucial role in this process, which is why having the support of these professionals is essential when donating prostheses to individuals benefiting from e-NABLE projects. And what's the role of each professional? I will speak just about 4 professionals here, but I know have more, but I choose these 4. So doctors. Doctors play an important role in the pre-prosthetic process, which occurs after surgery, and whenever is possible, in the pre-surgical process, which occurs before the surgery itself. When the patient knows it's going to happen, it's not an emergency. They also have a crucial responsibility during surgery, making every effort to preserve as much of the limb as possible. They can also assist in Adam, help me.
In determining.
Yeah, thank you. The suitable time for prostheticization, considering factors such as the healing of the amputation site, the patient's medical stability, and the advancement of rehabilitation. I don't know if you want to speak something about that, you can just talk, okay?
Sure. Yeah.
Now I think you want to talk, so physiotherapist. Physiotherapy plays a fundamental role in the rehabilitation process of amputee patients, helping them to regain physical function, mobility, and quality of life after the loss of a limb. The physiotherapist carries out a full assessment of the patients to understand their specific needs, level of physical fitness, and limitations. Physiotherapy involves prescribing specific exercise to strengthen the remind muscles, improve the flexibility and range of movements of the joints adjacent to the amputation and promote balance and coordination. Adam, if you want, it's your
No,
profession.
that's very complete. I mean, there I don't want to get too bogged down into any details for what physical therapists might do. There are other things that kind of bleed over into like what occupational therapists will do. I mean, beyond just the functional elements, there are things involved in amputee care surrounding ensuring that the wound from the amputation, if it's acquired, is being properly cared for. Education, making sure, I mean, range of motion is a huge deal in preparing for use of the device eventually,
Yeah.
because if you have limited range of motion, your gait is going to be significantly impacted. And that's true regardless of whether you're talking about upper or lower extremity. Um, but no, I think we can get into more. Maybe one day we can do like an all physical therapy. You know, like everything physical therapy does, then everything that occupational therapy does. But no, I think this is enough for here.
Okay. So we continue. We have psychologists. The role of the psychologist in the field of amputees is crucial in providing emotional, physiological, and social support to people who have suffered amputations. This experience can be extremely challenging both physically and emotionally, and a psychologist specialized in this area plays several important roles like physiological, psychological adaptation, emotional support, rehabilitation support, family counseling, promoting resilience, support for social integration, and education and information. So they are very important too. Sometimes people don't accept the prosthesis devices and they need help to understand why, and so they are very important too. And occupational therapy uh, plays a significant role in the rehabilitation and reintegration of amputee patients, focus on maximizing functional independence and participation in daily and meaningful activities. Training for activities of daily living, training the use of prostheses, adaptation of the environment, development of assistive technology device, prescription of the appropriate device. That's all. I don't want to speak more about that. So this is some of professions they can help a little bit with the rehabilitation process with prosthesis. And a lot of people ask for me, where can I find these professionals? So there are many professionals on the e-NABLE forum who follow e-NABLE and they know e-NABLE exists, but they don't participate a lot because they don't feel like they can participate about that. But however, you can find them in rehabilitation centers. I believe have a lot of rehabilitation centers in the world, so you can find them there. And another question I listen a lot, it's what do I ask a professional needs to know, professional care need to know about e-NABLE. So I will show to you just a moment. Hey, Sarah, you're here. Just a moment. I will share to you the
Yes,
e-NABLE.
I thought I'd join today. It's good to see you.
It's good to sound your voice. I really like your voice. So I will show to you, let me share my screen again, how enable website works, because I think a lot of people have difficulty to understand. So here for me appears the enable Brazil and enabling the future, who is the enable. And we have here home, histories, about, map of volunteers, learn more, donation shop. And here it's the best part because we have all the things separate. So need a hand, build a hand assembly kits and materials, map of volunteers, volunteer donations, favorite stories, our history, and enable hub. I click here just to, I put this here. This is the forum, but I will show you this before later. And if you want to build a hand, because you're going to make a hand for someone, you're going to come here. And this build a hand, it's important to healthcare and for makers, because here we have how to make an enable device for yourself, how to have an enable device made for you by a volunteer, how to get started as an enable volunteer, enable frequently asked questions, use for enable links, safety guidelines for enable device, enable device catalog, and enable digital badge awards, and everything. So here, it's the important part because we have enable device catalog, and this is very nice because we have with design, and here we have the most currently suggest designs for amputations for people who have the rights until here. So we have these designs, and I like the unlimited hand too. They are very nice. And for people who have the elbow, below the elbow, so this is the recommended prosthesis. And it's nice if you're a healthcare professional, you understand everything about the prosthesis and how it works, but this is the subject for another meeting. But it's nice. Okay.
Oh, sorry, Tonar. I wanted to hop on that point too, that as we as we expand these and look at additional topics and start bringing more folks in, I think you and I are going to be working together in the coming year to make more like specifically tailored materials for healthcare folks to learn more about these devices and how and
Yeah.
where they can be implemented. And I'm really excited to see how things expand on that front.
Oh, this is very nice. Yeah, I think this part could be better because you know what device you can use, and me and Adam we're going to discuss this in the ending of the meeting. We have the device, but sometimes, like I say in the start of the presentation, person by person is different, and it's not always the same amputation. You can have a thumb, you can have fingers or 2 fingers, or you can have a lot of different things. So sometimes it's you have to make adaptation in the prosthesis. So this here is for cases of success, totally success. It's not a difficult case, it's a beautiful case, and it's functional. The prosthesis will fit fine, it's not difficult. So here we have the suggestions, but I think we can update this here. And another thing I really like here, it's enable device color customizer. Here we have how to put colors to show to people, and here we have the devices. So some of them. So which device you're going to use, and you can put here the colors to people could choose the color they want. So my internet don't want to help me. Okay, so here, just to show to you guys, I can put this color here or this color here. And sometimes I can put things to make more, like here, I put the Batman logo in the hand. So, and I put Batman's bats, not Batman's bats here to be more beautiful. And to kids who like Batman or adults like me, I like Batman, so and you can do that. And here we have the currently recommended. So here it's the unlimited Phoenix hand. I really like this hand because it's like the unlimited arm, but different because we just need one proportion, but it's more easier to make it. I need to know better than others procedures to talk about them. But here in that we have another hand design, so it's a lot of designs to see if it works or if you can make adaptations or everything. Here it's arm design, so it's for below the elbow, and we have all this here. This is the most used. I think, I don't know if they fix it, the link. Oh yeah, they fix it. Okay, they fix it. It's here again. You can download now and have the protocol to understand how to print and everything for this model. So this is the part you can see and you can understand and you can study to understand how processes of enable works and to give opinions like what I can change in these models to they get better and better. If you can see Phoenix V2 hand, they have already a V2.1, so they get better and better. Unlimited arm V2.1 here, but they are in V2.2. So you can discuss this. Healthcare professionals can discuss this better because they understand about these devices. So it's important to understand every device here to speak about them and to say, oh, I think it can be better if you do like this. You can give our opinions. And here, I think this is just the most important part. So you came to enable device catalog, and we have all these things I showed to you. And we have the forum. So we have a lot of people here, and we can look the calendar. It's here, it's in Portuguese, so sorry guys, but you understand in English. So and here you have a lot of posts with questions, and you can ask this, and if you can participate, you can post what do you think about these questions and everything. So this is, I think it's the important part, and just a little bit of the important part to know about enable. Adam, do you think we can put more here? I think it's
Yeah, I think certainly there's more. I mean, I think this is maybe a function of this group. If we start getting more folks in these calls, we can start
yeah.
deciding what belongs and what would be helpful for folks.
Oh yeah, if you want to come here to the discussion, it's here in the calendar. All the meetings. So healthcare meeting. This is August. September, we have the healthcare meeting on, I have to change here, Sarah. It will be 4 September and 18 September, but later. So here we have the calendar. And for finishing my discussion, it's always important to find a health professional to help with the rehabilitation process. There are many professionals interested in helping on a voluntary basis, but they don't understand how they can help or how 3D printing works. So this is important. So that's why it's important to post in the forum of e-NABLE. If you are a health professional, go there, put your name and show yourself, because maybe have someone in your city who wants and who needs you to help with the prostheticization process. And that's it.
Awesome.
Really?
That was great. We talked last week, and I know you brought this up about going through some of the posts on the hub. Did you want to kind of walk through some of the questions? I know there's the one about that I think they were looking at, was it a kinetic hand where there was a partial thumb involved, and they wanted to see how and where
Yeah,
that might work.
I tried to find, but I didn't even have the link here, there with you.
Let me take a quick look. Let me see if I can find it.
I tried to find before the meeting, but engineer profession, the guitar. Oh, I think it's coordinate. Let me see if it's this. Oh, yeah. Wait.
Tenor, can we just to go back to the calendar, can you email me if there are any changes that I need to
Yeah.
make?
Yeah.
Great, thank you.
You're welcome. Wait a minute. I want to share my screen. Screen two. No, screen one. Is this? Is that posted? My maker's phone.
I don't think that this is actually, this is one we could speak on as well. But this is someone in need of partial finger replacement so she can play piano.
Oh, okay.
Still looking.
Um,
There's also, I think I heard you mention that. There's also the question about guitar picks
yeah,
for playing guitar, obviously.
here.
Yep. And then still running into issues. Well, I guess we can find the actual post at a later time. But if I remember correctly, they were talking about adapting a kinetic hand for an individual that has a partial thumb, which obviously would
Oh,
change
yeah.
that design a little bit. So maybe, I mean, I know that in my space, I honestly did not work a whole lot with individuals on like grasping activities. And I know we talked about that a little bit last time, 2 weeks ago, Tainara, about different types of grasp. But when you're getting into the thumb, I think that's really what it's all about, and that's why the thumb is there. So what I mean, what would you look at in working with like a kiddo? If they have a residual thumb, is that a case that you've come across in your practice, or?
I never came across with this in my practice, but I see a lot of this. I see with Phoenix hand, they cut this part here.
Mhm.
I don't know if you ever see that.
Mhm.
And they cut this part with the Phoenix hand, and the thumb, it's out, and it's just for these fingers here. So I see this with the Phoenix hand, but with the Connect hand, I never see that. But I think maybe it's possible cut. I don't know if you see this in the Phoenix hand. Where I saw that. I don't remember where, but I see people who make adaptations with the Phoenix hand. I think Phoenix hand it's more easy to make adaptations because of the development of the project
Okay.
and how it's constructed. So it's more easy to make meshes and to change at programs, different programs. But they just let me show the hands of Phoenix hands because it's more easy if I show this. Just a minute. Needle. I put the where is it? I have to make the download. I lost the hands. Oh, I have this printed here. Oh,
That's easy.
oh yeah, that's. They just cut this part here, and the thumb can. They make a hole here, and the thumb can put this side like
Sure.
normal, and they can use the thumb with the prosthesis.
Yeah.
So I see this with this prosthesis, but with the connector, I don't know if it's possible to make the same thing, to cut this part, and I can cut this part in the Fusion 360
Yeah.
uh, and with another programs. So I think it's more easier with this model to make the adaptation.
Yeah.
Next hand, it's I don't know.
Well, you know, another thing that we've been talking about a lot is whether, when I say we, I mean, this has come up in town halls a couple of times recently, and you and I have had discussions about this. But whether, creating a hand that looks like a hand is really the best way to go. I think there's also the middle ground possibility of designing something that has some specific grip functionality, like like a split hook that allows for like pincer grasp.
It,
Does something like that work with a residual thumb? Like if you had a thumb, would it be possible? And I'm just spitballing here, but like, would it be possible to have a functional half hook that would be opposable to the residual thumb? Or is that getting into a little bit of I don't know if that would truly be functional.
it's difficult. The difficult in the healthcare area, it's all depends.
Yeah.
It could be work, and it's maybe we can make my boyfriend listen our meetings Friday,
Oh,
and
cool.
he gave and they gave idea who you can make a prosthesis who is functional with a grip with a hook. But if you want, you can put the fingers. Like I can make something to put a glove, I don't know,
Hmm.
to change to 5 fingers. If people want something like this, I don't know if it will be more useful, but you can change your prosthesis. So it's like most uh adaptive thing. So that's the idea too. To you have a hook, but you can put fingers. I don't know. something like this.
Yeah,
I don't know if
there's also, I mean, I know that there's the Nick finger design, and for people with residual, at least a little bit of residual finger, like if you
yeah,
have your proximal phalanx, then you can use that. There's a really cool company out there called Naked Prosthetics, and they have a really slim profile glove device. Ba-da-ba-ba. Yeah, this is a long article. I won't share this, but there's a really cool. You can oppose any finger using this simple glove unit, and I'd really like to see if we can recreate something like that. Obviously, I wouldn't want to steal their steal their design, but I need to post that in the hub sometime, because it's really nifty the way that it's able to replicate the fingers that have been lost. I think that most often, though, if you're talking about a partial amputation of a hand, it's going to be less likely to be a loss of digits with some residual limb left, well, residual phalanx left. I think it's probably going to be across the palm that you're talking about, so you really wouldn't have that action.
okay.
Well, sorry, and I'm just blabbing. Let me just ask
No,
a couple of quick.
you're free here.
Yeah. So something that comes up on the hub every now and then is measuring. So and getting some kind of assessment tool in place to determine how effective the devices that our community members are providing actually are in changing some level of function.
Yeah.
Do you use any functional tools in your clinical practice, and if so, what are those and how are they implemented?
To make measurements to know if you're going to work.
Yeah, well, I mean, generally, like if you're talking about like a functional test, so if you like, do you have like any test batteries that you use, like
Oh,
you pick up this set number of objects in a certain amount of time, like the box and blocks is one that was floated a little while ago on the hub.
yeah.
Is there anything like that's been tested for upper extremity amputees and their function?
Yeah, I like to first I like to see the size of the amputation. So I can see if the prosthesis will fit. That's the first thing I look at. So if it's like the unlimited arm, if it's not if it's this size, just this size, it's not going to work. So I like to see this. And I always ask for the measurements to know if it's going to work. And have a person, it's where I put, oh, here. I have a case here in Brazil now that I thought the case were perfect for Phoenix hands, but I have to be sure. So I told her to send to me I don't know how I speak this in English. The
Sorry, the
oh
socket, is that what you're referring to?
yeah,
The
but it's
wrist?
when the model. It's just the model of
Oh, the
her.
mold?
Yeah,
Sorry, I
the
don't know
mold.
what you're. Okay,
Yeah, this is the mold from her. So that way I have the size, I have the os ocean speculoos here, and it's going to fit well, and I can see if it's going to work. So I like to use this too. If it's possible, I say to person, send to me this mold here. I don't know if you understand.
yeah,
I
no,
hope.
no, totally.
Yeah. And if when I deliver the prosthesis, and I like to see too, the biceps. If the person have a good biceps, because it's important, because all the force it's in the biceps. So that's why I like to work with physiotherapists. They can bring the force to the biceps to work the prosthesis. So I think this is very important too.
Gotcha.
And yeah, and if a person lost her limb and she have a lot of it's not fits. It's, let me see in the translator. Wait. If the person have a flat arm, yeah, it's difficult to use the prosthesis because it's the prosthesis don't fit so well, and it's difficult to bring here to be useful. And I like to see these two. I like to see three things. Like, this is three things I see before give the prosthesis for the person. And after I give the prosthesis, I make exercise to take balls and take things, and if maybe this thing need adaptation to take better and everything. So that's if the person are comfortable with the prosthesis, if have something hurt.
Painful.
Yeah, thank you very much. Oh, today.
Yeah.
It hurts. Yeah, it's something hurts, and if you need to put something here, like something more comfortable to help to grab things, and here you need the silicone things to put in the fingers.
Sure.
So yeah, so things cannot split like this. So that's everything I see. I think, I don't know if I answer you.
No, you did. I think that I think that there are just so many things, and this is really why I think the two of us wanted to get a group together to start talking about these things, is there's so many things to look at. You know, it's really, as much as we want this to be open and accessible to anyone who has 3D printer to, you know, try.
Yeah.
It's going to be, I think, more and more important that people in the community make at least a good faith effort to reach out to a person's care team. You know, if they have an occupational therapist, if they have even a social worker, anyone in the recipient's network who can weigh in on, you know, how the device will be used and what the person's actually going to be doing with it. I think that's going to be very, very important for anyone, because obviously there's a huge amount of expertise that comes into clinical care. You know, occupational therapists and prosthetists have years and years of training to get to this point, which is not to dissuade people from printing these devices. But I do think that we need to keep in mind that there are a lot of resources out there and a lot of people who can make sure that whatever is printed for folks are actually, you know, resulting in some kind of positive change. So
Yeah,
that's my
it's a lot of
soapbox for
things.
that. Yeah.
Yeah, we have a lot of discussions to bring in here to healthcare meetings. So a lot of important discussions.
Yeah.
But I think today for me, I don't know if you want to talk more.
No, I think that's great.
Okay.
So
Okay.
are we planning on keeping these up twice a month, do you think?
Yeah,
And
yeah, next month will be twice a month because we have, for September, we have a guest from Brazil.
awesome.
It's a friend of mine, Natasha. She makes a lot of assistive technology with 3D printer, and she's a huge name here in Brazil. So I think it's important to bring her to speak a little bit about assistive technology and the ready device we have in Thingiverse, manufacturing, and how we can use and everything. So
Beautiful.
for September, we have Natasha, and 18 September, we have me and you again to speak about how the devices work and how I can, this part, how I can measure the functionality and how I can see if the person is ready for the prosthesis and everything. So this is the discussion of 18 September.
Awesome. Okay.
Yeah, and I will make the
So
calendar too.
that's
October
Oh.
for you, Sarah.
Okay. And just the first one, it's September 4th, not the 14th, right?
Yeah, yeah.
Okay. Yeah, if you could just email me, like if it's anything different from the Word document that I have, just email me and I'll make sure it's correct on the newsletter. But thank you for doing this. This is great.
Thank you for the help. I will send you again the document, but the document will be with
Okay.
the correct data. So it's for September. We have Natasha here, and 18 September, and I will make the October calendar and I'll send to you, Adam, so we can see if it'll be 1 month meetings or 2. Okay.
Works for me.
So thank you guys again. I hope you like it. So bye guys. Good week for you.
Bye.
Thanks, Sarah.
Bye.
You too.
Bye.
Thanks you. Bye bye.